At EHA 2023 this year, I'm very excited to share some of our cutting-edge analysis working with the BMS team and the correlative studies that were done with patients treated across the KARMA study. So with ide-cel, also now commercially known as Abecma, from the initial registration study KARMA-1 through KARMA-2, KARMA-3, to see if there are certain cytokine profiles of the patients getting the Abecma treatment that might predict who are the patients who might have, more severe cytokine release syndrome or just more severe CAR-T-associated side effects with the treatment. With the overarching idea that maybe some of this information can, in the future, guide us in how to be more risk adapted in assisting patients with management. So this is a very sophisticated analysis involving informatics team that looks at a composite of high number of cytokines and also serially across time through the first month for patients who are on treatment to look for patterns. And then that entire pattern of the mix of cytokine profiles and how that changed over time was then consolidated into a single risk score for the patient. And then we clustered patients with unbiased, clustering to see if there are any patterns. And there were a number of clusters that came out, but what's most interesting was that there was a cluster of patients with what looked like more of a macrophage appearing signature, cytokines associated with these particular types of immune cells, as macrophages, that seems to correlate with these patients who had these more severe inflammatory side effects. And so that would suggest that, these are the patients we can delve into more, what is happening from an immune profile biology standpoint, and can we use that information to help risk adapt patients going into CAR-T management.